Assalamu alaikum. I am Dr. Sultana Faruki, lecturer at Anatomy Department, Bashundhara Ad-din Medical College, South Keraniganj, Dhaka. Today my topic of discussion is cavernous sinus. Let's start. What is cavernous sinus? Cavernous sinus is a large venous space between two layers of dura mater. Position: it is situated in the middle cranial fossa or either side of the body of the sphenoid bone. Formation: the floor of the sinus is formed by endosteal layer of dura mater. The lateral wall, roof and middle wall are formed by meningeal layer of dura mater. It is extended anteriorly up to medial end of the superior orbital fissure, and posteriorly it extends up to the apex of the petrous part of temporal bone. It is about 2 cm long and 1 cm wide. Now, what are the relations? Structure that related outside the sinus. Superiorly, optic tract, internal carotid artery, anterior perforated substance. Inferiorly, foramen lacerum, junction of the body and greater wing of sphenoid bone. Medially, hypophysis cerebri and sphenoidal air sinus. Laterally, temporal lobe with uncus. Anteriorly, superior orbital fissure and apex of the orbit, and posteriorly apex of the petrous temporal bone and crus cerebri of midbrain. Now, structures that are related to the lateral wall of the sinus. Maxillary division of trigeminal nerve, oculomotor nerve, trochlear nerve, trigeminal ganglion and ophthalmic division of trigeminal nerve. Structures that are passing through the center of the sinus, that are internal carotid artery with the venous and sympathetic plexus around it. Abducent nerve, inferolateral to the internal carotid artery. Now, let us know about the tributaries of cavernous sinus. From the orbit, superior ophthalmic vein, inferior ophthalmic vein, central vein of retina. From the brain, superficial middle cerebral vein, inferior cerebral vein. From the meninges, sphenoparietal sinus and frontal trunk of middle meningeal vein. Now, about the draining channels or communication of the cavernous sinus. The cavernous sinus drains into transverse sinus through superior petrosal sinus, into internal jugular vein through inferior petrosal sinus, into pterygoid plexus of veins through the emissary veins, into the facial vein through superior ophthalmic vein. The right and left cavernous sinuses communicate with each other through the anterior and posterior intercavernous sinuses and through the basilar plexus of veins. All these communications are valveless and blood can flow through them in either direction. Now, clinical importance. Thrombosis of cavernous sinus may be caused by sepsis in the dangerous area of the face, nasal cavity and in the paranasal air sinuses. This may give rise to nervous and venous symptoms. This is all about today's discussion. Thank you to all.